This video is on how to do a digital or finger nerve block. If you're new to regional anesthesia techniques, this particular block is an excellent block to begin to develop confidence and skill in regional anesthesia. Thanks for watching, and thanks for learning with us.
Medical Specialists Associates, making medical education more accessible.
Thank you for joining me today. I'm Christopher Voscopoulos of Medical Specialist Associates, and today's topic is that of a digital nerve block. Now, where might we perform a digital nerve block? We might perform a digital nerve block, say, in the ICU, or perhaps maybe in the emergency department, in an individual, say, with a finger laceration. This particular block is considered an anatomic and a field block, and so knowing the anatomy is crucial to its success. However, prior to us turning our attention to review the anatomy, let's first see the equipment that we'll need to perform the block successfully. So here I show some equipment, and let's go through it one by one. The first thing that we'll need is some type of sterilization device. Here I show a ChloraPrep stick. We'll also need some type of local anesthetic. Here I show 2% lidocaine, and this would be fine. Lidocaine works, say, quicker than bupivacaine, say 0.25% bupivacaine. However, lidocaine also wears off faster. And so depending on what your needs are, a quicker onset block versus a block that lasts longer, you might have some consideration over 2% lidocaine versus 0.25% bupivacaine. You'll also need a syringe to draw up the medication, as well as two needles. One, an 18-gauge needle here to draw this medication up in an easier fashion. And then for our actual block, we want a smaller needle. So here, a 25 or maybe even a 27 gauge needle, and a short gauge needle would be fine because, again, we're talking about the anatomy of the finger, which is usually quite small. So again, the anatomy is crucially important. And what do I want to point out here in this particular slide? I want to point out that you have two nerves, one on the top here, the dorsal digital nerve, and one on the bottom, called either the proper volar nerve or more commonly today, probably the palmar digital nerve. And this particular anatomy is replicated on the other side, meaning that you have one nerve on top, one nerve on the bottom on this side of the finger, and the same exact anatomy repeated on the other side. So now let's take a look at this anatomy in a bit different fashion, now looking at it head on. And here you can see that you have one nerve on top, again, the digital nerve, the dorsal digital nerve here, and one nerve on the bottom. Again, the palmar digital nerve here on the bottom. And again, this anatomy is repeated on the other side. And how would we perform this block? Well, what you're going to see in the live demonstration, I'll go over it with you once here, is we're going to come down with our needle and we're going to gently touch the bone here on top. And we're going to pull back about 1 to 2 millimeters. And then in this particular vicinity here, we're going to continue to pull back, make sure that we're not in an artery or a vein, and then we're going to inject about 1 to 2 cc's of our local anesthetic. And then what we're going to do is we're going to guide the needle against the bone ever so gently here until we come to the palmar surface right below the skin. And again, we're going to pull back. We're going to verify that we're not either in an artery or a vein here. And once we have negative aspiration for blood, then also we're going to inject 1 to 2 cc's here. And then we're simply going to repeat the procedure on the other side. So now let's take a look at what this is going to look like on a live demonstration. So here you can see how quickly the procedure is done. We come down and we touch bone, pull back about 1 to 2 millimeters, make sure there's no aspiration of blood, and inject 1 to 2 cc's of local anesthetic. And then now we continue to go down the side of the bone towards the palmar surface of the hand, and we make sure again that there's no aspiration of blood, and inject 1 to 2 cc's of local anesthetic again. Now we repeat the procedure on the other side, again coming down and touching bone, pulling back 1 to 2 millimeters, making sure there's no blood return, injecting 1 to 2 cc's of local anesthetic, and then coming down again towards the palmar surface, again now pulling back, making sure there's no blood return, and injecting 1 to 2 cc's of local anesthetic again. Thank you so much for watching and learning with us today. If you're interested in taking this class for credit, or if you're interested in our other services, such as our direct clinical care services, please visit our website at www.med-specialist.net or click on the link in the description below. Also, make sure you subscribe to our channel to stay up to date on our most current content and educational opportunities.